Yeah, let's move on. So what is the green arrow? Okay, we have the green arrow over there. Okay, on the upper right. What is it pointing to?
TMJ.
TMJ. Yeah, exactly. So
Yes.
TMJ is short for temporal mandibular joint. Okay, so temporal, temporal bone. That's part of your skull. Mandibular. Okay, that's referring to your mandible, your lower jaw, and joint is like pretty much a connection, right? So TMJ is temporal mandibular joint. Okay. So when we look at that, we have to make sure that there's a good amount of that the bone itself is healthy, and that there's adequate space between the two, right? Because we want that space because we want a disc to be able to exist in that space. If let's say the space is too little, then that is that is implication that maybe the disc is perforated or the disc is worn out. Okay, and so something that you might want to ask patients is, have you had any clicks or pops or difficulty opening or pain? Right? What is that white circle in the arrow?
Sinus.
Yeah. So it's actually it's actually the maxillary sinus, because you have actually a few sinuses in the face. But the sinus that's most important to us in kind of dentistry is the maxillary sinus. And essentially the sinus is an airspace underneath your cheek. Important for us because some of the roots of the upper molars can be extended through the sinus cavity, right? Some of the roots can be very long. And so when you take out those teeth, right? When you take it out, you may cause some opening between the sinus and the mouth. Okay, what's that blue arrow right there? That arrow is meant to point out the inferior alveolar canal. Because this is an X-ray, you can't see soft tissue, and nerve is a soft tissue, right? So we're assuming that there is a nerve there, but that is actually the inferior alveolar canal. Okay, and that's important to know, especially when we're taking out wisdom teeth. Is that, as I said in my group, that sometimes when you have deeply impacted wisdom teeth, or your wisdom teeth roots are very long, okay, those can be really close to that nerve. When you take out the wisdom teeth, sometimes that nerve can be pushed or injured, and the patient may experience numbness because that nerve controls the sensation of your lip and chin, and the patient may experience either transient, most of the time transient numbness if it does happen, or sometimes even permanent numbness as well. So last but not least, I like to look at wisdom teeth last. Okay, when I look at these type of X-rays, I look at everything else first. Okay, and this is called kind of the bias. It's called satisfaction of search. You want to make sure that the most obvious thing you don't look at. You look at the least obvious things. And so we can see all four wisdom teeth, and you can see the one on the left side, the 32. That one is going horizontally. So that one's actually considered pretty difficult to take out compared to the other ones. Okay.